Hi, my name is Heidi Steiner. I'm currently a graduate student at Weldon University, and my practicum experience has been focused on informatics concepts within nursing education. And I've spent some time here at Rochester College, and also I've spent time at Oakland University these past 12 weeks. And I have a presentation for you today that will talk about how we can incorporate technology into the care of the patient. When I was preparing for this presentation, I had not yet come up with a title for my PowerPoint presentation. And I called our Director of Nursing, Kathleen Van Wagner, and asked for her input. She wanted me to somehow incorporate the caring aspect into my presentation because we hear so many times that the nurses spend too much time in the computer and not with their patients. And we're trying at Crittenton Hospital to incorporate caring behaviors into the patient care utilizing technology as a tool. So with that in mind, I went back to our relationship-based care journey that we've been embarking for the past several years and came up with the title, Using Technology to Care Through a New Lens. The picture you see here was developed by our nursing leadership team at Crittenton Hospital because we have embraced the journey of relationship-based care to focus on our patients while we as the center of our care team at Crittenton. So with that, the objectives for today are to define nursing informatics, summarize the 6 quality and safety education for nurses, or QSIN competencies, and I'll talk about that in a minute, differentiate between computer skills and informatics competencies, because they're two very different things, describe how informatics can help progress data to wisdom, identify ways to use the EMR to integrate the following informatics concepts into a clinical simulation. We want to talk about decision support rule, evidence-based practice, a reminder to provide imperative data, data mining, and interdisciplinary care plan. And you'll see all those in the scenario that we'll provide following this presentation. What is nursing informatics? Nursing informatics is sort of a hard thing to define. Early definitions focus more on the technological part of it. So in 1989, Graves and Cochran defined it as a combination of computer science, information science, and nursing science designed to assist in the management and processing of nursing data, information, and knowledge to support the practice of nursing and delivery of nursing care, which is very wordy. I like Roy Simpson definition that it's a moving target. That's a lot simpler. And a lot of these concepts are what nursing informatics is about, but it is a moving target and it's still moving, and it will probably move for several years to come. In 2008, however, the American Nurses Association defined it as integrating nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. Facilitates the integration of data, information, knowledge, and wisdom to support patients, nurses, and other providers in their decision-making in all roles and settings, accomplished through the use of information structure, information processes, and information technology. That is the current definition according to the ANA. In 2003, the Institute of Medicine published a report, Health Professionals Education, A Bridge to Quality, and it challenged nursing educators to redesign curriculum based on the following competency areas: patient-centered care, interdisciplinary teams, evidence-based practice, quality improvement, safety, and informatics. And from these came the definition from nursing leaders, which led to the QSIN competencies. I'm not going to read all these definitions to you, but these are the QSIN competencies that we are focusing on, or that they wanted us to focus on for education. But the key point is we have patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. There used to be 5. Informatics was always one of them, and then they added safety, I think, a little bit later. But the key point that I want to make here on this slide is that informatics is needed for all the rest of them. There is informatics concept woven in all 5 of the above QSIN competencies. And the QSIN competencies What they are telling us is that there are specific knowledge, skills, and attitudes that will help nurses prepare for safety and quality in the workplace. And I'm going to do a simulation scenario for you today. And the reason we're doing a simulation scenario is because it has been a way to interactively learn, and it lets the nurse practice in a very safe environment. This is considered a low-tech simulation that we're going to do for you today, but there are several other options for simulation that you can use in the classroom to incorporate informatics concepts into your nursing curriculum. Nurses today are expected to do a lot of things. They're expected to work and partner with patients and families, communicate effectively, use strategies such as SBAR, background and teaching, and ensure patients are receiving care based on specific evidence. Informatics can be used to help with all those different expectations for the new nurse. Sometimes I've heard over the years, and I've been doing this since 2005, that the younger nurses today already know how to use technology, so they don't really need informatics classes in their nursing education. This is not true, because utilizing the computer is not using informatics. The computer is a tool. It's what we get out of the computer that helps us keep the patients safe. It's the things we can utilize the computer for when we're planning care for our patient. And the scenario that we're going to go through in just a minute will show you a couple ways that you can use these informatics concepts just with one patient scenario. The computer helps us convert data to wisdom. These are all little pieces of data. Female is something we put in the computer. Years, 45, regular, pulse, 72. Those are all things we might click on in the computer. What do we do with that? We synthesize that to come up with some information. And then we combine that with some of our past experience and knowledge, and we find that the pulse is normal for a woman who's 45 and of that age, woman and female. And then that combines with our years of experience to tell us that there's no nursing action required. Everything looks good for that woman's pulse or that patient's pulse. So the computer helps take all these data points, synthesize it together, and then we pull it out to make the best decisions for our patient. That's a very simple example of that. So now what I'd like you to do is watch the following scenario, and there's a handout you can follow, and what I'm looking for is ways that we use the computer for decision support rule, and you'll see that in the scenario, and we'll talk about that afterwards. How do we use it for evidence-based practice? How do we remind the nurse of imperative data? How do we use the computer to pull data out, or data mining? And then what do we do with our interdisciplinary care plans to help us focus care on the patient?